trauma.
Estamos listos.
Medical care for patients suffering from cardiovascular disease and trauma was not always like this. Exhaustive organizational efforts, international cooperation, and especially the collaboration of the most important institutions of Costa Rica were required to engage all the parts harmonically into gear in order to provide adequate medical care to the citizens of a modern society. Cardiovascular disease and trauma, afflictions of a modern society. The development of a medical emergency system in Costa Rica. But let's go back in time. In the 40s, infectious diseases and malnutrition were the main causes of death among our population. Costa Ricans died young, before they reached the age of 40. Health conditions have changed dramatically in Costa Rica over the past 50 years, thanks to the development of primary care programs by the Ministry of Health and the Social Security Administration, which in turn led to a shift as to the main causes of death in our country. As Costa Rica made amazing progress in terms of health standards, new afflictions started to appear on the statistics. We were facing new illnesses that were very different from the traditional ones, and therefore different curative methods were also required. This called for an alert community, efficient transportation, pre-hospital care, and emergency specialists. The idea of creating a national medical emergencies program is set forth in 1987 by a group of Costa Rican physicians. The proposal is then submitted to the president of Project Hope, Dr. William Walsh, who gives it his wholehearted support. This initiative is further encouraged by the National Emergency Commission thanks to the endorsement of its chairperson, Dr. Manuel Aguilar Bonilla. This is the local counterpart that was needed to make this project a reality. The Hope Foundation, a private non-profit U.S. organization, contributes 50% of the resources. Project Hope provides assistance at different levels. It assigns international advisors and donates equipment for educational laboratories, rescue units, ambulances, and hospital emergency services. This is how the National Medical Emergencies Program came into being. The activities of PRONEM are broken down into three main categories: community action, pre-hospital care, and hospital care. Its basic purpose is the development of a national emergency medical system in Costa Rica. The system provides for assistance in everyday emergency cases, mainly resulting from trauma and cardiovascular crises, as well as assistance to the population in eventual disaster conditions, whether due to natural causes or to the action of humans. The three areas are closely interrelated in order to be able to act in coordinated fashion under extreme conditions, and to help each other on a day-to-day basis. PRONEM has been active in two basic areas: the training of human resources and the procurement of infrastructure for the provision of services. It prepares specialized personnel in each aspect of emergency assistance and later supplies them with the equipment required for the efficient performance of their duties. At community level, the goal is to prepare the population in order for it to know how to activate the system through the use of the 911 single alarm unit and what to do while waiting for specialized assistance. To the present, courses on introduction to first aid, cardiopulmonary resuscitation, preparation for disaster conditions, and public education campaigns for accident prevention have been given. With regard to pre-hospital care, the action is oriented towards a shift from the concept of taxi ambulance to assistance to the victim at the site of the accident with the care necessary to help the victim arrive in better condition in the hospital, where final treatment is provided. Thanks to PRONEM, the Red Cross currently has 25 new units for emergency assistance distributed throughout the country, which were equipped to provide assistance to trauma and cardiovascular disease patients. In order to improve the quality of transportation, a course on the handling of emergency vehicles was designed for purposes of improving the driving abilities of ambulance drivers through supervised practices. At the pre-hospital level, a course is also taught on rescue from vehicles. This course is aimed at rescue unit personnel. Its purpose is to teach them how to rescue the victims of traffic accidents from vehicles in a critically short time, usually less than 10 minutes, while observing all measures of safety for the victim. At hospital level, the objective is to improve assistance to the patients through the standardization of procedures at the emergency services. Another purpose is to ensure a highly professional handling of a heavily traumatized person during the initial 60 minutes, the golden hour, during which the timely application of the right therapeutical procedures shall save the lives of the patients. PRONEM supplies these laboratories with dummies for all types of contingency. There are cardiopulmonary resuscitation models and others for working on airways, electronic simulators, heads with trauma, men, women, children, and babies. Everything that's necessary is here, but the most important thing is that there is a willingness to continue training the human component, which in the end is what makes the difference between life and death. Costa Rica is a small country which has nevertheless succeeded in finding the way to a national medical emergency system in a very short time by taking full advantage of its own resources and welcoming the solidary support from its friends abroad. Upon the completion of its mission, PRONEM now welcomes CNEM. The disappearance of PRONEM is a symbol of triumph. Its evolution is a sign of life.
Latin America must move in the 21st century with effective solutions for the problems that afflict our people. Trauma and cardiovascular diseases require the development of national emergency medical systems that can intervene in the early phases of the diseases, the golden hour, and save many victims from a premature death.